joining us on Syncing Up with Your Physicians webinar presented by the Jackson Group Employee Insight Team Senior Client Consultant Connie Saunders. I'd like to introduce her this morning. Before we get started, you have a little background about her. She has a Bachelor of Science degree from Wake Forest University and a Master of Arts degree from Central Michigan University. Entering the healthcare field as a medical technologist, Ms. Saunders transitioned to a mid-sized North Carolina hospital and gained valuable experience directing education and marketing for 5 years. After her graduate work, she moved into healthcare human resources, where she worked for 15 years as a Chief Human Resources Officer for 2 North Carolina hospitals. She has presented at national conferences and most recently presented Employee Engagement, What Works at the SHRM National Strategy Conference and at a regional healthcare marketing conference, Enhancing Physician Relations by Using Technology to Communicate, Top 5 Ways to Sync Up with Your Physicians. Her article, Manage Physician Satisfaction, or ELS, was published in the Physician Strategy News. Ms. Saunders has been with the Jackson Group for 13 years and works closely with members of the Employee Insight team as a senior consultant, assisting clients with analyzing survey results, action planning, and developing leadership teams. I want to take this opportunity now to thank Ms. Saunders for taking time to speak to us today about syncing up with your physicians.
Suzanne, thank you so very much for that nice introduction and for your work on this webinar project. It's my great pleasure to come to you today and just share some of the insights from the Jackson Group research and from our experience working with physicians across the country in doing medical staff engagement surveying and employee insight baseline surveying as well. And I start off with a kind of an interesting bit of information. I many times will read Dr. Robert Lambert's work on Medscape. He's a frequent contributor to that website. And he published, I think it was on one of his blogs, how he used kind of time management. He figured early on as a physician that he signed 200 documents a day. And it's interesting now that's certainly done electronically. But he learned it took him 3 seconds to sign his full name. And if he did a squiggle, he would call it, only 1 second. And so he very quickly calculated that would be so many seconds and minutes and times 18 days in a month. And to make a long story short, he figured out he could save 24 hours in a year's time. So that's just to give you some insight into how our providers, I should say, think today. And looking at the next slide, looking at the next slide, sorry for that little technical difficulty there. But anyway, when we look at different audiences, we want to learn how they best like to get information. And as we're changing, as technology is changing the way we communicate with our providers and with the way providers communicate with their patients, I'm reminded of a Charles Darwin quote. It's not the strongest of a species that survives, nor the most intelligent, but the most responsive to change. So as we sometimes see resistors to change, when we move to a different method of communication, I think we can be reminded of this quote. In working with physicians, the main thing they want to do with communication is to be able to connect better with their patients, coordinate their care, and have access, be more efficient, have better access to care. So following this webinar, what we'll be able to do is identify the key drivers. And we have a very educated audience, so I know you have been exposed to the key drivers or domains of satisfaction, and we will use that information in planning communication. We'll also think about innovative and use innovative technologies to communicate with physicians, and then throughout the presentation highlight some best practices for successful communication with providers and their medical groups. So the 5 ways to sync up with your physicians. First and foremost, using those key drivers with what we know about physician satisfaction. Then in using those key drivers, learn ways that we can onboard practices with technology. Many of our clients across the United States are in the process and have employed many physician groups and acquired additional physician groups and are learning to communicate with these groups in advance of the contracts being signed, emerging these groups into the culture of the particular healthcare system, and this can be a challenge sometimes. So being sure that those physicians receive timely communication. We're seeing our clients use more text, emails, instant messaging, and so forth, involving the physicians in decision-making on technology, what options are available, and even there's a best practice on, by each provider, learning their preferences for receiving communication. I'm reminded of a funny story with one client, a very large client in Florida, and we were feeding back the survey results, and we had the chief information officer in there, and she shed some light on our participation. We had good, strong surveys, and so one of the brainstorming ideas that came out was that there were plenty of emails for each physician, but what we didn't have information on was which email the physician read, and one of them volunteered that he had 6 emails but only looked at one of them. So I think that's something we have to take into consideration as we work with physicians and other providers. Using creative design, of clients now have physician portals, and then also using social media. I think about every healthcare system we work with, as you go onto their website, you'll see more and more use of social media. Using data from physician satisfaction surveying and patient satisfaction results to highlight in recruitment and reward and recognition of physicians. So these are some of the ways we know that we can be successful in syncing up with physicians. Over the key drivers or the main satisfaction, there are 5 key areas based on the Jackson Group research and other firms' research as well, and in the academic literature. One of the domains, of course, is income and financial aspects of being in a practice or being employed by a healthcare system. Another important driver is the relationship with other colleagues, physicians, administrators, and other healthcare professionals and the patients. The market environment, what's happening as far as medical malpractice, certainly with governmental issues and regulations, managed care, and then the location of that environment changes from state to state. That is something that we can't control as a healthcare system. We can advise, we can consult, we can provide resources, but that is a key driver that's more difficult to impact. The practice environment, the specialty area, the size, the types of patients, the makeup and structure of that practice, and who's kind of in control of that practice, which comes to the next key driver, which is autonomy. We know that providers certainly enjoy autonomy and want to still be very involved in decision making. So how are these key drivers identified? These are the ones that we pull from our research, but in order to know those key drivers, we recommend surveying those providers. So there's engagement, medical staff surveys, face-to-face conversations between leadership in a healthcare system and certainly the providers in their system. Town hall type meetings, focus groups. We can even set up an electronic focus group, electronic dialogue that we can have with physicians. And I think you're going to be seeing more of that as we know that, I think there was an article I read recently that the doctor has left the building. So many of our physicians are in the practice setting only and come in for rare meetings with the advent years ago of the hospitalist and intensivist. So our opportunities to interface face-to-face with physicians is somewhat more limited today. We also need to think about the likes and dislikes the providers have about being employed, kind of the pluses and the minuses, the advantages and disadvantages. And according to a survey done by Medscape, which included 4,600 physicians in 2014, the top 4 disadvantages that were identified by these respondents at 45% indicated limited influence in decision making. And this is one of the areas when we survey our clients that we see there's opportunity for enhancement. 44% limited income potential. 34%, there were too many rules. So you can see how that autonomy kicks in, and the financial key driver also is related to these advantages and disadvantages. 32% indicate less control over their work and their schedules. So as we communicate with those employed physicians, we need to keep those in the forefront of our mind and be sure that we answer any questions and address those key drivers. 4 advantages that this particular population identified: 58% indicated not having to deal with the business of running a practice. The providers enjoyed that. 45% not having to deal with insurers and billing, and we certainly hear those comments and read those comments when we survey providers. 42% indicated guaranteed income or even cash flow, and 28% indicated the benefits package was certainly an advantage. So as we communicate, we also want to think about how we're communicating physician to patients and how that's changing. Now with the patient portals offered in most medical groups now, many of the physicians are using texting to have their office schedule appointments. Let's look at it from the patient's perspective. And an interesting study conducted just a few years ago by Susanna Fox with the Pew Research Center, looking at the general population in the United States, indicated 59% of adults, and it's probably much higher today, say they have looked online for information about a range of health topics in the past year. 35% indicate that they've gone online to try to figure out what medical condition they or someone else might have. So I know the medical community out there is concerned about controlling this, that being sure their patients get good patient education and information and not just surfing the internet and coming up with perhaps some misinformation. So we're seeing more of our practices get involved in that patient education and controlling that aspect of it. Another part of that study dealt with mobile health, and 1 in 3 cell phone owners have used their phone to look up information, health information. You can almost envision people in emergency departments or doctors' practices Googling particular health topics on their phones, and half of these were, of course, smartphone users. And again, this would be escalated if we were to do this study today. 19% of smartphone owners have downloaded a health app on their phone, and I know just this morning in a meeting, someone was talking about tracking their number of steps with their tracking device, the Fitbit. So we're just seeing so much more of this. And so as we consider communicating with our patients, this becomes a great way and a great vehicle, for example, to do emails on patient satisfaction surveys and get responses from that patient audience out there. We also know that family caregivers are wired for health. 39% indicate that they're caring for a loved one with a serious medical condition, and that these caregivers are heavy technology users, even more so than the general population, as they seek information. Knowing that 45% of the adults in the United States say that they live with 1 or more chronic conditions. But we also have to consider with the patient population that there is a certain segment of the population that are not wired, are not online for reasons, economic reasons. But recently, the Jackson Group did a study for an entity here in the county with the homeless population, and we were surprised to find out that many of the homeless individuals had cell phone usage, smartphones, because that was the only way they could connect. And so, sadly speaking, that was their access to find social services here in the community. So, tracking health, we mentioned that 7 out of 10 adults track health indicators of themselves or a loved one. So now the bottom line, technology is playing a great contributing role to healthcare information and the need to know as consumers in healthcare. So looking at syncing up with physicians, we know that many of the groups are certainly using social networks and where they can share videos, information, podcasts, but there's also been some information in the literature that we have to be sure and weigh and balance risk versus rewards. And we also have to be sure that patient information is not compromised in any way. And I think we've come a long way with that, with having AMA standards on social media. And I know there was a group here in North Carolina that researched that, the Residency Social Media Task Force a couple of years ago, and had contributing organizations in our state. So that as we define it, we also have to have rules of engagement, so to speak. So looking at physicians and social media, 40% of physicians believe that digital technology with patients can really improve outcomes. And as we become more outcome-based and values, performance-based in reimbursement, we know this is important to have their support. 40% indicate they have increased use of digital tools. And this was according to a study in 2014 done by Ken Terry and support and reported in Medscape News. And again, I think this would be larger. It's almost become the new norm now, so these percentages would go up. 22% of physicians text with their patients, and 25% use patient portals to communicate. And I think, again, this would be increased. One area digitally that is slowly evolving is the use of telehealth and video consultations. And this has been slowed basically because of the limitations in regulation and fee-for-service payment, but is evolving, especially in use in remote areas for consults. Looking at respondents in another survey conducted by the Canadian Medical Oncology Group and reported in the Journal of Oncology Practice in October, a more recent study, 2015, indicates one of the possible barriers that we must look at, in that social media use is much higher with the age group of 25 to 34 years at the highest of 93%, and then lowest was in the age group of 45 to 54 years, and that 39% was a bit surprising. I thought it would actually be with an older age group. And so that we know as we work with clients, as we work with patients, that we have to take into consideration generational differences. In the last several years, most of the conferences, the medical conferences, have used some type of social media, and during the conference it becomes very helpful. I know I just recently spoke at the North Carolina Healthcare Recruiters Association, and everything was put online before. The presentation was online before the conference actually started, and then a lot of texting and tweeting was going on throughout the whole time of the conference, and it really enhanced communication. And here we see some other emergency medicine and critical care. Life in the Fast Lane is a directory of blogs and podcasts. And then also there's a free open access medical education, a public domain forum that has multiple websites, videos, and podcasts. Very recently, in I believe in January, at the American College of Cardiology in a scientific session, one of the leaders in using social media and getting that more acceptance was David Shearer, who is a physician that reported to Medscape through their HeartWire that physicians are still very highly regarded. So the best case scenario is that social media will help reconnect people on a human level, patient to physician, and vice versa. Another example reported at Stanford, My Heart Counts, made headlines last year with 40,000 people downloading the app to join the study. And in closing, Dr. Shearer said more patients are choosing their health insurance, their physicians, their hospitals, procedures through social media. So it's here to stay, and we need to be sure as consultants, as providers, as those in healthcare systems, that we are using it at the maximum percent and that we are following the guidelines as we are using this appropriately, and that we capitalize it. And bottom line is that we improve patient outcomes through use of digital media. We know that certainly syncing up with physicians has to begin with involving physicians in decision-making, finding out their preferences for communication, and then always linking communication to quality patient care, as that's the key driver of physician engagement. Trying different technology in communicating, and assessing continually what's working well with communication and how can we improve that. Using multiple methods of communication based on age groups and preferences, and stress the advantage of using social media for communication, education, and even mentorships between providers. I'll remind you again, the top 5 ways to sync up is always keeping in mind the key drivers of physician satisfaction, using onboarding practices that introduce the culture of the healthcare system to that particular medical group, involving physicians in decision-making with technology options, and creating interesting websites, portals, and use of social media, and being sure that our communication is succinct and is on a need to know. Certainly, I think it's interesting to see how our clients use our survey results, and most of them will design just a one-page bulleted item that gives the results of the survey, what we feel good about in the survey results, and then where there are opportunities to improve in those key areas. And I know in looking at the Jackson Group surveys, the couple of the areas that we see that we can improve in giving information and working with physicians in our database is at a level of 63.7% of the providers, the participants, indicate that they receive timely communication. So that is an opportunity for enhancement in a number of my clients. And then at a level of 58.3% agree that they respond to their request. These are a couple of areas that we find are frequently shown and identified by the data as opportunities for improvement. And as we always do, if you have any questions for an ongoing dialogue, you can reach me at csaunders@thejacksongroup.com, at our 800 number, 800-554-0373. Also, Suzanne Jackson is available at the website sjackson@thejacksongroup.com. And in closing, I certainly appreciate your time and invite any further questions or a need for further information, as we've just scratched the surface of this important topic of syncing up with your physicians using technology to communicate. Thank you very much.